guests. André Picard is here, a public health reporter for the Globe and Mail. He's received a number of accolades for his reporting on mental health and mental illness.
Merci. Moi aussi, je vais m'adresser à vous en anglais, si vous me permettez, juste pour être comme tout le monde d'autre, mais je suis content de répondre des questions en français un peu plus tard. So I'm not here to defend journalism or media wankers, because that would take too long and would be impossible. But I want to deliver three key messages about the media. One is that the media does matter. The media influences policy, perceptions, stigma. But I think what we just heard is very important, that the media is not just the Globe and Mail, Radio-Canada. That's the easy part to deal with. It's the larger media, the portrayals in movies of mental illness on TV, etc. That's a much harder part on the internet. So I'm just a little part of the puzzle, but I want to talk about that part of the puzzle. So that's number one. Number two is there's no question that the portrayal of people with mental illness in the media is skewed. And that should surprise no one. The portrayal of everyone in the media is skewed. And we write about bad things. We don't write about good financial advisors, we write about Bernie Madoff. I had a boss when I started at the Globe who, whenever I pitched anything even remotely positive, would say, listen, the sun coming up is not news. Right? We don't want to hear about the good stuff. That's not why people buy papers. That's human nature. So we like it or not, we have to work in that model. So in that model, what gets covered? Well, what gets covered is the outliers, the worst of the worst. So I'll give you two examples. Vince Lee. So everybody knows who Vince Lee is, the Greyhound bus killer. Vince Lee stabbed and decapitated and cannibalized another passenger on a Greyhound bus. Vince Lee had untreated schizophrenia. Well, how do you think schizophrenia got portrayed in the media that week, that month? Not very well. Not surprising in the least. Just like Bernie Madoff didn't make financial advisors look very good. We shouldn't be surprised about that we're going to cover that. We're always going to cover that. Another example, Joshua Lall. Joshua Lall was an architect in Calgary, living in the suburbs, perfect family, stabbed to death his wife and his two children and his tenant. Totally unexpected. But we found out later he had untreated mental illness, he'd been hearing voices, etc. He was too ashamed to go get help because he didn't want to be portrayed as having mental illness. He thought it would destroy his career. That didn't make people look very good with mental illness, but we're going to cover that story in all its gory detail. Now, how can we make things better? I think we have to cover that. What the media is not doing well is giving context. So what the context in those stories is this. To me, the story of Vince Lee, and I wrote about this, it's not that Vince Lee had schizophrenia. It's that he had untreated schizophrenia. His family tried repeatedly to get him help, and they couldn't. That's the story. We ended up doing that story pretty well. Later on, of course, because we do the spectacular stuff first before we do the thinking. But that's not a bad thing, as long as we do it. So we have to do more of the context. Same thing with Joshua Lall. It took a while to explore why didn't he get help? Why did he decide, if Joshua Lall had a heart attack, he wouldn't have hesitated to go to the hospital. He had a brain attack. And what did he do? He hid in his basement and he murdered people. So we have to understand why that happened. So that's what we're missing, is the context. And to me, that's part of the larger story. So those are crime stories. I covered health stories. Health stories, how we have to make them better on mental health is, I think, to normalize mental health issues. So my philosophy at the paper is I cover mental health the same way I cover any physical health story. I think the distinction is artificial. So I cover heart disease a lot. Heart disease is a leading killer of Canadians. So what do I cover? I cover advances in medication. I cover people having trouble with their drug plans, getting new surgery techniques, how they deal with time off at work. Do they get proper EI when they have a heart attack? I want to cover exactly those same issues for someone with depression or bipolar disorder, because it's exactly the same issues. We shouldn't make the distinction. And I think we'll be successful in the media when we do that, when we cover the research in the same way, when we talk to people in the same way, illustrate our stories with patients. Now, it's really easy to do with the heart disease. I can phone up the Heart and Stroke Foundation and say, Can I find a 76-year-old woman with left ventricular failure who's having trouble paying for her drugs? I can get them in a second. Everybody wants to tell their story. Now, if I call the Douglas Hospital and say, can I get someone with bipolar disorder who got fired because he was doing weird things at work? It's going to be hard to illustrate that story. It's true that the voices of people with mental illness aren't in the media. It's not because we don't want them. It's because they're really difficult to come by. Now that's getting easier, but it's changing very slowly. The other part of normalization is giving context to those health stories as well. So again, when I write about heart disease, I write about 75,000 people a year die of heart disease. So many million Canadians have heart disease. I put it into that context. We have to do the same with mental illness. 6 million Canadians have mental illness this year. We have to make that normal. The vast majority of them get better, just like most people with heart disease get better. That's how we normalize it, is just giving that factual information. Now, I said things are getting better, and I want to talk just in closing for the last couple of minutes about why they're getting better. It's not because we're suddenly better people, we're more kind and generous, we have abandoned our stigma about mental illness, and we've dropped our stereotyping. All that stuff still exists. The reason coverage is getting better, the reason governments are taking action, they're creating a mental health commission, is strictly self-interest. It's economic. And the economic issue is really important. It's your biggest ally in selling this story. So mental health problems cost the Canadian economy about $51 billion a year. That's about twice as much as heart disease. Mental illness is the leading cause of absenteeism in Canada. About 500,000 people a day in Canada call in sick because they have a mental health problem. Now, usually they call it something else. I've got a backache, I've got a cold. One of my favorite quotes ever was a psychiatrist who told me a lot of backaches occur above the neck. Meaning that people don't always say what's wrong with them, but there's something wrong with them. We joke about mental health days, but they're not a joke. They're a real economic burden. And that's a reason that business has got interested in mental health. First, for self-interest. Mental health is always also the leading cause of disability, both long-term and short-term. So again, it's this economic reality that spurred action. That's not a bad thing, but you have to understand, you have to speak the language of policymakers to make them stand up and take notice. And people in the movement were very smart to do that, to realize, talk money to people who care about money, and action will be taken. So final thing, I have 1.5 minutes. I'm a journalist, so I can stay right on time.
Not like academics.
No, that's not a dig at Rob at all. So the last thing is, again, I come back to this. My goal is to try to normalize, but it's difficult to normalize mental illness. It is difficult to write about it the same as any other illness. One, because I said it's hard to get those voices. The other one is that mental health issues are different than other chronic illnesses. They have this whole other social aspect to them. The poverty piece of the puzzle is really difficult. There's a lot more people with mental illness who are poor than people with cancer. It's a disease whose major symptom is poverty. It's not something physical. And we forget that, and it's hard to write about that, and the media's a bit squeamish about writing about that stuff. Because again, it makes us uncomfortable. The other thing that makes us really uncomfortable that we have to talk about more openly is that mental illnesses are the only conditions for which we jail people. We don't jail people for any other sickness. It would be unthinkable to jail a woman with breast cancer if one of the symptoms of breast cancer was going around and yelling in the streets, swearing and pissing on people's lawns. But that's a common symptom of people with psychosis, and we put them in jail, and it's a disgrace and it's a travesty. And that's the kind of thing that makes it different, but makes it all the more urgent for the media to cover these issues in a different way. So with 30 seconds left, I'm going to end on a positive note and say things are changing. They're changing really quickly, and there is hope. And I'll give you my example of hope is I go back to, I started at the Globe in 1987, started writing about health. And back then we wrote about cancer very little. cancer was still a shameful thing. You didn't like to admit you had cancer. You didn't talk about it in polite company. I was told we didn't write the word breast in the newspaper. That was a bit much. We said women's cancer when we said cancer. We were very delicate. We tiptoed around things. There was stigma about cancer. That changed. It changed because of a social movement, because people said, screw it, I'm going to tell my story. I'm not going to be ashamed of it, and I'm going to demand change. And that's what's happening in mental health, and that's great. And that's why we can have evenings like this. But when we talk about cancer now, we have evenings at the Queen Elizabeth Hotel with nice canapes. When we talk about mental health, we're still up on the main with, crowded into a stuffy room. So there's still some work to do, but you're getting it. So thank you.